People sometimes describe Ottawa Inner City Health as a hospital without walls because it's very much based in the community. All the organizations who have a mandate to address health needs for the homeless came together and they formed this new organization. We have 7 different programs. We have a managed alcohol program, a program for women, and our TED program. We have a hospice and a primary care clinic and a special care unit for men. In addition, we have 2 housing programs, both of which are in the west end of the city. One is called The Oaks and the other is called Booth House.
Go well.
The future should not be centered around the hospital. These are patients that do not necessarily come to hospital and admitted for acute care problems, which is what hospitals do, but these were patients who could not be managed in the community in primary care, weren't sick enough for the hospital, but there was no place to go.
We were just trying to figure him out first, you know?
Good morning, lovely people.
Hi.
How are you?
How are you guys?
When I went into this environment, I thought I was just going to give some antibiotics and homeless people would get better, maybe treat some tuberculosis or some HIV. But then I recognized if I didn't treat their psychiatric problems, I couldn't treat their medical problems. But then I recognized I couldn't treat their psychiatric problems until I treated their addiction. And you can't do any of that unless you have a stable housed environment with community-based services that wrap around an individual.
Hello. This looks good.
There you go. Excellent.
How are you doing? Are you winning yet?
Nice deep breath.
I have COPD, so he comes quite a bit because I get pneumonia easy. I have a respirologist. I have to take 3 inhalers now.
Well, you're definitely doing better than you were last month.
I've been here about 3 months. I was in the hospital and they were trying to keep me in the hospital. And I said, no, I didn't want to stay in the hospital. I get too claustrophobic and panicky. I was just like, no, I want to go home. I call this home.
Inner City does really the health component. We branch out and we also get people to appointments and make sure they have ID, but we try and also use the other services in the shelter as well. There's money management being offered. There's school systems in Ottawa for people who are in shelters. There's a lot of supports that learning how to navigate and find the right thing is a real challenge. Most of our programs, we have case managers that are hired from the shelters that will help with a lot of those extra things.
In the past, population health approach has really been divorced from other kinds of strategies and has been sort of seen as a world onto its own. I think that that's rapidly changing and that we're recognizing that real change and real impact comes from marrying those 2 strategies together, and that's really how you'll affect the changes that you want to have.
I dye my hair white. It normally is dark color, but I like to get a good white in it.
Get more respect.
Yeah, that's what I'm thinking.
Traditionally, we have an approach that we say, one size fits all. You come here and you get your care, and if you don't get their care, that's not our problem. This moves the care to a more patient-centered or client-centered approach, takes a unique population and say, how can we bring care to you on your terms? Yes, we provide services in shelters, and we partner with those shelters, but it's the Ottawa Hospital reaching out to its community. We're working with ambulance services, paramedics, the police department. You can't get the results unless you actually have everybody working together.
Mike Alpha Romeo Charlie Echo Lima, 1960 0506.
Female unconscious on a bench. No other details at this time.
This is a typical intoxicated individual call. We respond alongside of the paramedics and then indicate if the individual is going to the hospital or is going to Shepherd's or to a shelter.
We've seen in the first 6 months of the program that we've diverted 750 ambulance calls.
You're going to the Sheps?
I think that the public would benefit from this type of program. These homeless individuals are no longer drunk and disorderly on the street. They're not disrupting the business community. They're not detoxing in the emergency department. We can reduce wait times, we can reduce hospital utilization, and we can get better care, and they can become better citizens. We know from the data that their costs are between $170,000 and $220,000 per person per year. We had one individual in the 6 months before the program had been in the emergency department 191 times. Treating them in an acute care facility, you can't afford to do that. It's just too expensive. And we can deliver services much more effectively at a cheaper price out in the community.
Our entire program is a little under $4 million. The reason that our budget is as small as it is we're able to leverage all these other resources from our partners. And so for every dollar that we have in Inner City Health's budget, we have at least another dollar in somebody else's budget. So in total, Inner City Health, if you add all in what it costs to operate, is actually more like about $7.5 million. It doesn't make any sense to build an infrastructure when you can use somebody else's.
Now you could argue that, why should we bend over backwards for these marginalized populations? And other than compassion and a commitment to service, which I think are important Canadian values, but at the very least, I think you have to make the argument that this saves you money.
Any study that we've done, any evaluation, any research we've done shows that at minimum you save $3 of taxpayers' money for every dollar that you spend, and people are healthier and they get better care. It's pretty hard to argue against doing a better job and spending less money. James had some interactions with us because he was trying to get help around his addictions. And since he started to work with us, he's really made very, very rapid improvement. I think we all feel that the prognosis for him around the feet is excellent. I think more importantly, the prognosis for him around the other things that have been troubling in his life is also excellent because he now seems to understand that there is help available. He can actually trust us to do the right thing for him. And I would suggest that probably, his future is extremely bright as a result. If you look at other cities who don't have similar kinds of services, what you see is that there's very high rates of emergency room utilization, much higher rates of police interactions, and that people do die from complications of these diseases at a very young age.
I would say today, population health would be the term that could be used for treating today's patients as a system, truly as a system, as opposed to having them go from silo to silo. The Ottawa Hospital's mandate is a tertiary quaternary academic center that teaches future health professionals and does leading edge research. And that is my goal, and that's the Board of Governors' role. I think it's very difficult to sort of say, well, let's just kind of put that aside, and now you're responsible for the population health. But it's not that. It's not an either or. It is, yes, you've got to do that, but you've also become more engaged in population health. Obviously, this is a new project that had a wonderful vision, focused on better quality of care for patients and less cost. But one of the big challenges was trying to find out which ministry, which government, and which ministry would own it. The federal government had a stake in it. The municipal government has a stake in housing and social services. And then even at the provincial level, was it Ministry of Health responsibility or Ministry of Social Services? I'm not sure anybody envisioned what it would take in the new millennium to have a sustainable, high-performing healthcare system. But I think it's becoming much more obvious today that the status quo is not going to get us there. The solution is not in the hospital, but it's not probably in any other silo that exists. It's something different, and it's something that we create by working together.